call 911 or call for help, mga ganun. No? Then, bago mag-CPR, cover the patient with mask. Tapos, itilt mo sana yung head ng patient away from you kung walang cervical spine involvement. Bakit? Para hindi lilipad ang aerosol papunta sa'yo. Then you can start compression of 100 to 120 per minute. Straight, kung kaya mo, straight 2 minutes. Bawal mouth to mouth. Mouth to mouth. Okay? Kasi solo ka lang, nasa field ka. Then, habang nagko-compress, nagkataon, sinuwerte ka naman, merong defibrillator. Letter C, connect to the defibrillator and wait for the voice call or follow the voice call. Nabuhay mo or hindi nabuhay, ongoing CPR. Number 10, kasagsagan ng COVID, ginawa ko to. Kaya ginamit ko yung word case evacuation. Ang case evacuation ay isang terminology ng combat medicine. Kapag ang isang sugatang sundalo ay isinakay mo sa isang ambulansya or air medevac helicopter designed for medical evacuation, ang tawag tactical evacuation. Pag sinakay mo sa helicopter na hindi design sa medevac, ang tawag doon case evacuation. Ganon din sa lupa. Isinakay mo sa ambulansya, ang tawag doon tactical evacuation. Isinakay mo sa likod ng pick-up or na hindi siya design na ambulansya, ang tawag case evacuation. So, letter C ulit. Number 10, case evacuation. Bakit? Nung panahon na kasagsagan ng COVID, tandaan niyo ito ako, naka-ethnic. Simula alas 3 hanggang alas 5, wala pong tumulong sa amin. Kasi lahat ng ambulansya ay nakadedicate sa COVID. So ito, bumulagta sa motor, tinulungan namin, tinawag ako alas 3 ng umaga. Isipin mo, may pulis pa yun ha, merong pulis. Pero walang tumulong. Walang ambulance in the heart of Manila. So ang nangyari, nakakuha ng dinala ng pick-up. Nag-commander ng pick-up. Ayan. So ang tawag doon, case evacuation. So that's your tendency of survival. Yan. Ngayon, kasama sa basic life support, hindi pa talaga full-fledged na in-incorporate. Pero mahinay na in-incorporate ang stroke kasi mataas din yung incidence ng stroke. Sinama na yung stroke at sa basic life support, alamin lang natin ano yung mga parameters to know na patient is suffering from stroke. Okay? Ikinumbine ang Cincinnati Pre-Hospital Stroke Scale into an adjust Cincinnati. Ang Cincinnati Pre-Hospital Stroke Scale ay fast. Ngayon, yung adjusted ay tinawag nating ito B-fast. So number 1, letter B, there is suddenly loss of balance. B, balance. Loss of balance and or brain fog. Sudden, yung parang nakalimutan, hindi alam anong nangyari sa paligid, brain fogging. And or behavioral change, para siyang hindi ma-maintindihan ano yung behavior. So tatlo po yung B. And then eyes, sudden blurring of vision. And or yun ay, ibig sabihin ito lahat, hindi lahat pwedeng mangyari. And or. Tapos, and or facial asymmetry. Yung one side of the face nag-droop. And or arms or leg weakness on one side. And or slurring of speech. So yung T natin, time. Bilisan. Kasi stroke yan. Wala kayong magawa. Para CT scan, malaman natin pag yan ay bara versus sumabog na vessel. Yan po ang emphasis. Hindi pa yan nakalabas sa interim guidelines, pero in the future, isasama na sa BLS si stroke. Inunahan ko na lang kayo. Okay, ito po ay isang real scenario. Although ACLS to. So status epilepticus ng bata, kinuha namin sa Tumaguete, kasagsagan ng COVID, at nabuhay namin siya papunta sa PGH. So ano ang, although ACLS na to, no? Ano ang forma ng nag-BLS? So 4 lang po. Initially pag BLS, kung solo ka lang, compression ka lang, tapos kung may EED ka na maabot, ikaw na yung nagko-compress, ikaw yung mag-EED. Dumating si airway, yan. Dumating isang tao sa BLS, yan yung trio. Nagde-defib, na kapalit ni compression. Tapos si airway, wala siyang kapalit. Airway lang siya. So nag-compress ng 30, bigay ng hangin 2, 1 and 2. Kapag dumating na isang tao or meron ka ng cold blue team, ACLS ka na, IV meds na yun. Saan si team leader? Defibrillator. Sa lumang panahon, si team leader ay nasa paanan ng pasyente. Dahil sa interim guidelines of 2022, in-emphasize nila na mawala na tong leader dito para ang 5, 4 na lang. Ang team leader is also the defibrillator guard. Okay? Kapalit ni compression para hindi mapagod kasi yung emphasis ng 2020 American Heart Association is palitan si compressor every 2 minutes. So magpapalitan lang yan sila. So the compressor now is also the team leader. Kaya sa Code Blue, pag nag-standard Code Blue training talaga sa ospital, lahat is capable of team leading. Kasama yan sa Code Blue training, ang team leading. Hindi katulad ng dati, si airway pwede palitan. Ngayon, si airway, fix lang siya. Ang airway is not necessarily 1 man. It can be 2 people. Pero hindi na pwedeng magpalitan. Ipapalit sa iba na magiging IV siya. Kasi yung tinatawag nating closed circuit assembly, kasama tao doon. Pag ipalit-palit ko siya, pinapakalat ko rin si COVID. Kung si COVID naka-confine lang dito na hindi ma-airborne, hindi ma-aerosolize, dyan lang siya. So yung mga aerosolize, pag dumikit sa katawan nila sa gown, tapos lumipat ako, nasagi ko si IV med guy or staff, nahawa, na siya, napahira na siya. Kaya si airway is mandatory, static lang siya, dyan lang siya. Okay. When do we stop CPR, ladies and gentlemen? We stop CPR by remembering stops. Number 1, S, spontaneous return of breathing and circulation. Siyempre, bumalik na yung buhay, huminto ka na. T, transfer to higher level of care. For example, EMT ka. EMTB, dumating si EMT paramedic, huminto ka na kasi take over na. Ngayon, EMT paramedic ka, dinala sa ospital na take over si ER nurse, huminto ka na. Take over na siya. So, yun yung transfer to higher level of care. Operator is exhausted. Mamamatay ka na kasi CPR, huminto ka na. Baka ikaw yung pangalawang mag-arrest. Okay. P, physician's advice. Sa legal medicine, the physician is the captain of the ship. Huwag ka nang kumontra. Unless the physician medyo hindi siya familiar, i-correct mo lang siya in a nice way. Pero physician, kunwari ako, hindi ko naman sinabing magaling ako, pero hindi niya. Pag sinabi kong guys, stop, hindi na ako kontrahin kasi part sa pinag-aralan ko is I have to ascertain between the probable signs of death versus the definitive signs of death. Pinag-aralan ko yun. Huwag na kayong kumontra kasi sa legal med, the physician is the captain of the ship. Yan. And then S, scene becomes unsafe. Kunwari, nagsi-CPR ako, tapos sumabog yung oxygen doon sa kabilang room, nasunog. Anong gawin ko? O di hinto ang CPR, kalad ka rin yung pasyente palabas, kalad ka. Kung hindi mo kaya, nag-iisa ka lang, kalad ka rin mo. Yung tinatawag na blanket drug, lagay mo sa blanket. Pagdating mo sa hagdan, kalad ka. Walang nang pagkit, magalit man yung magalit, pero hindi mo kaya yung pasyente, wala kang katulong. Kinaladkad mo yung head part, yung kanyang puwet bumabangga sa stairs, flight of stairs. Bagbag, pababa. Pagdating sa first floor, paglabas, walang katulong, dinrag mo doon sa parkingan, tuloy ka CPR doon. Yun. When the scene becomes unsafe. Tandaan nyo ha, stops. Okay. Paano kung na-break ng rib? Makakasuhan ka ba? So meron tayong Article 12 dito sa RPC natin o Revised Penal Code, Paragraph 4. Any person who, nurse and doctor, while performing a lawful act with due care, pero talagang on that moment, talagang nag-snap lang yung buto, causes an injury by mere accident without fault or intention of causing it. Okay? So, the circumstance will exempt you from clinical liability. Kasi in good faith naman ginawa, hindi mo naman, unless di ka marunong, ang posisyon ng sole of your palm ay nasa ribs, hindi sa sternum, madadali ka. So meron tayong Article 12, Paragraph 4. Okay, remember, 85 to 90% of arresting patients will show ventricular fibrillation. Yung kirig-kirig na ventricle, hindi pulseless beta. Okay? So, yan po yung si Chief Caliao, nag-cardiac arrest. Nag-fire akong dalawa, nabuhay siya. Hindi ko na alam anong nangyari sa buhay niya ngayon. Hindi naman siya nagparamdam kung buhay o patay pa. Pag buhay siya, nagpasalamat man lang, hindi ko naman ninais pasalamat. Kung patay siya, minulto man lang niya ako. Pero, that moment, ang ganda, maraming witness paano siya nabuhay. Okay? So, guys, that ends the lecture. Now, I'm gonna give you like 15 minutes break. 15, yeah, 15, because I will assemble an extra camera and dummies para ituro ko paano mag-rescue breathing, F-bomb management, tuturo ko ha. So, sige, magkape muna kayo para hindi kayo maantok. At mag-aayos lang ako na. Okay? And you have any question? So you don't have any question. So I will prepare my demo materials. Kung meron kayong tanong, you can post it inside chat or write it in the chat or maybe later kung wala pa kayong ma-devise or maisip na tanong. Okay, so 15 minutes.
Hello po, good morning po. For your attendance po, kindly send your names po na mag-a-appear po sa certificates sa meeting group chat po. Mag-send po ako ng example sa group chat po. Also, ilalagay nyo din po yung training po na in-enroll nyo po. Thank you po.
Okay. So let's start our demo. First and foremost, I'll start with echo. Number one, doon tayo sa choking. Sa choking, sensya na, yung mga damis, nahihiwalay yung ulo. Tinali nila pa. Sa choking, yung mild obstruction sa severe obstruction. So yung approach mo sa mild obstruction, be on the side of the patient. If it's sitting down lang muna. Nasa side ka, jam, tapos i-ano mo na paghinga, huwag masyadong aggressive. Baka bumaon malalim ang obstruction. So, comfort mo siya, sir. Hinga lang, hinay-hinay, inhale. Tapos, kapit sa likod, cup. Cup, sir. Sige, cup. Ganon. Cup. Huwag na yung cup sunod-sunod. Hinay, hinay, hinay. Pantayin mo kung nag-discolor. Tapos, kung may marinig kang sound. Cup. So, mayroong cup na malakas. May cup na pag grabe na yung obstruction, hindi na malakas. Or no cup. So, ganun ang approach natin. Now, if there is severe obstruction, usually the patient is struggling. Side ka pa rin kasi pag nagkaharap kayo, pag hinawakan ka niya, hindi ka makapag-maneuver. So, side ka pa rin. And then, kung kaya niyang tumayo, sir, sige, tayo, sarili na tayo. Para nasa likod ka to prepare for abdominal thrust. Yung paa mo, nasa between sa limbs niya. Na gano'n. Para kasi kung ikaka ka lang gano'n, nasa in-between yung paa niya, or pareho kayo nag-gano'n, bigla siya nawala ng malay, at mabigat sa'yo, nakayakap ka, palintong kayong dalawa. Nangyari na sa akin yan, no? Ang laki pa ng mama, Egyptian doctor. So nasa gitna, para in case na matumba siya, the patient can slide. Atras ka lang, maslide mo siya sa lupa, check for responsiveness. If the patient is unresponsive, call for help, basic life support ka. So pag nag-abdominal thrust ka, simple lang, kunin mo lang yung C-point process. Ayan ang C-point process. 2-finger breath na, and then gawa ka ng ganito. Okay, push towards 45 degrees, papunta sa scapular area. Okay. Sa isa, ito kasi meron. Sa isang, dalawa ang camera ko, isang naka-side para makita niyo. So, boom! 2, pwedeng 3, 3, tingin. So, sige sir, hinga, sige lang, hinga. 1, sa totoong buhay, may gumawa nito live. Sumuka talaga ang pasyente. Hindi siya na, inano lang, yung para sinubukan lang ano ang feeling. So, nasuka yung pasyente. Nagkataon na around less than 30 minutes kakakain niya. So, may pagkain pa sa tiyan na isukan niya. So, malakas na puwersa to, lalo na pa it's done properly. Until the patient recovers or until the patient becomes unconscious, then you perform CPR. Pero pagkakaiba CPR dito, sa ibang guidelines, yung Utstein style or sa Netherlands, kunwari from foreign body airway obstruction, nagkaroon siya ng nag-block na, perform CPR. Ang ginagawa nila yung 5 and observe. 1, 2, 3, 4, 5, silip. And 1, 2, 3, 4, 5, silip. Para pag may lumabas, kuha ka agad. Kasi usually, pag lumabas yan, ang tendency ang pasyente, hihigop ulit kasi walang hangin eh. Hihigop yan, babalik sa loob. So, tulungan mo, lalo na pag pasyente hindi na kaya. Usually, pag gaganon yan, side ka agad, bilis ka agad, tapik, tapos sabay sweep out the obstructing material. So, kuha, hindi yung mga 4 counts pa. Hawak dito, boom, papik, tapos kuha. Sige, hinga lang malalim, hinga. Pag nakapabor na, huminga na, magkilos ng kamay, baba mo, yung 4 counts, 1, 2, 3, and then recovery position. Tingin. Yung iba naman, dahil sa COVID, pabaliktad. 1, 2, 3, palayo. Pareho lang yan as long as you perform recovery position. Same you do sa bata. No? So, pag unconscious na siya, wala na po tayong abdominal thrust na yun, hindi na po natin ginagawa. So, chest compression ka na diretso. Tapos, tingnan mo pag may lumalabas, you commit to chest compression. Okay? Pag sa baby naman, same thing. You have to check what blocks the airway. Pag nakita, sweep. Mabilis na sweep. No? And then, pag hindi nakita, don't blind sweep. So, gasping yan. Hindi mo alam. Pwedeng ang pinakamalapit sa totoong buhay, hindi mo talaga alam. Ang pinakamalapit dyan ay the mother tells you, merong na ano dyan sa loob. So, ang gagawin natin, 5 by 5. Sa totoong buhay, kung sa salitang Bicol, malumuyon, very soft ang baby. So sa dami, pwede mo siyang ibaliktad-baliktad na gano'n, parang totoo. Pero hindi po, sa experience ko, sa field, hindi. Talagang hinahinay. Sliding, hawak yan. Tapos, gano'n. Tapos, itong kamay, lalaylay pa. Ito dito. Tapos pag mag-backslap ka, matatakot ka pa kasi kailangan ito, nandito sa dibdib, ito hawak. Hindi dito. Masasakal siya. Gano'n, no? Ito ang kanyang chest stop, back stop to. Yan. Tapos slap. 1, 2, 3, 4, 5. Hawak dito. Hawak sa kamay. Sa training kasi, ginaganon lang. Hindi, sa totoong buhay, naramdaman ko, hawakan mo pa to. Slide. Slide ganon. Hindi kisa ganon kadali. Tingin. Tapos, gagawing itong try mo, gagawing parang chessboard. At tawag nito, parang cardiac board, sorry. Chessboard, cardiac board. No? So, kung saan ka mag-compress, naman tayo. Silip, 1, 2, 3, 4, 5. Silip. Pag may nakita, kuha ka agad. Kuha. Pag wala, slide, scoop, hawak sa kamay kasi lalaylay yung kamay. Paglabas, pero slide ulit. Hindi siya yung hindi mabilis. Sa totoong buhay, hindi mabilis-bilis ganun, ha? Yan ang totoo dyan. Okay? So, 5 back slap. Pag mag-back slap ka, nandito ang spine niya. So, ang tumatama nasa scapular area. Pataas. Huwag itama sa ulo. Kaya, pag ano, yan, 1, 2, 3, 4, 5. Ulang nahulog. Slide. Hawak, silip. Pag meron, huwag iganon. Ano lang. Kuha. Kuha. Kunin mo. Slide palagi. Yan. Pag walang nakita, slide. Yan. 1, 2, 3, 4. May lumabas na object. Tayo. Hawak. Sige, kuha. Ganyan ang style. Because that's what I did. Although the baby, nabuhay ko siya. And stayed in the ICU for 12 days. At 14 days. Namatay siya doon sa infection. Sayang. Pero nabuhay siya. Nangitim na yun nabuhay ko siya. So that's for foreign body airway obstruction for adult, same with child, and then for infant. Now, another thing I want to teach you is the use of AED. Again, ang AED ay pang laymen, lay people, hindi pang atin. Pero sige lang, assuming ito yung meron tayo. Kaya ko ini-emphasize kasi dahil pag nag-aral kayo ng BLS, ang maririnig yung AED, puro AED, baka ang pag-orderin nyo sa ospital ay AED. So, malaking kamalian yun. No? Ang ino-order natin ay yung standard na defibrillator na merong AED override. Manual siya ng AED override. Okay, so ganito si AED. Wala lang, tinanggalan ko lang ng baterya. So, kahit anong brand, you have to ask me, meron ako tatlong preference. Merong bago ngayon, German technology made in China. Tawag doon Mind Ray. Okay siya, ginamit ko sa Turkey, gumana. Mind Ray. Wala lang sa akin, meron ako Zol. Ang matagal kong kasama sa buhay ay Zol. Ngayon, Zol. So yung Zol ko, ano siya, ruggedized military AED siya, ruggedized, pwede mong bagsak, pwede mong sagasaan. Matagal din akong gumamit ng life pack. So sa Zol and life pack, ang life pack ko wala akong AED, puro manual. I have two life pack. Wala na sa akin ngayon. Meron kumuha, hindi sinauli. Pero nasira na siya. Tagal ng panahon. Yung isa, ginamit ko pa sa Mount Everest. Kaya medyo historical. Iniwan ko sa isang AMT school para magamit na nila sa dry fire. Tapos yung isa, hindi sinauli isa. Pero ano na rin, depleting na rin siya. Kasi yung screen, hindi na naglalabas ng display ng ano. Siyempre, lahat ng bagay, mayroong hangganan. Pero maganda, may historical value sa atin. Tapos may nag-donate sa akin ng Zol AED when I was studying in Australia. So nag-donate sa akin ng Zol. So tapos may nag-donate din sa akin ng Zol AED. Yung Zol manual defib, ano pa yung mga luma, 360. Dalawa kasi available na AED ngayon. By virtue of energy release. 360 monophasic, saka 200 biphasic. Pag sinabing 360, ang tawag nito pads, yung iba paddles. Ang paddles yung kamay na merong hawakan. Ito pads. Pag sinabing, yan ang position. Sternum side to apex side. Pag sinabing monophasic, nag-fire to, sasaluin ito. So, meron siyang parang i-accept niya yung impulse or energy coming from it. Hindi pwedeng hindi niya i-accept. Or else, the electricity will travel all over the body. Bakit? Kasi 70% of our body is composed of water. I mean, water is 70% of our body, and water is conductor by virtue of the electrolytes present in the water. Kaya, di ba, sa physics, electricity travels in time, in line, in space, in time. Okay? So, fire, tanggap. So, yung pag-fire nito, dadaan siya dito, masasagasaan yung heart, kaya ang heart mapupunta. Okay, that's 360 joules. Ang biphasic ganito, mabilis. 200 joules lang siya, mas maiksi, pero dalawa ang nagpa-fire. Fire, tanggap, fire, tanggap. Dalawa. Fire dito, tanggapin dito. Cross siya, cross. In a millisecond, tapos fire dito, tanggap dito. Kaya sa biphasic. Dalawa, fire. Okay? Pero hindi niya kailangan na mataas na energy required, hindi siya na energy release in joules. Kasi nakita nila si 360, electricity pa rin siya, nakaka-injure siya ng heart. Nakaka-cause ng heart. But it's still effective kung wala. No? Kung gumagamit ka ng 360, it can still be okay compared to no defibrillation. Because sabi ko sa inyo kanina, CPR with no defibrillation, mababa ang chances of survival. So, pag i-kompleto ko yung package ng chain of survival, so after compression, high quality CPR is the defibrillation. So sa defibrillation, umakit ako between 70 to 80% na ang chances mabuhay siya in a certain age category. Okay. So that's the difference between a monophasic and a biphasic. Okay? So karamihang mga modern AED ngayon ay biphasic. Wala na akong nakitang monophasic. Si Mind Ray, meron siyang adjuster, ito 360. Which is okay. So depende kasi sobrang kapal siguro ng chest ng pasyente, yung skin, subcutaneous tissue, medyo maganda pag tinaasan mo ng joules. So meron mga ganun. i-adjust. Nagbabago, nag-evolve kasi yung mga machine as time goes. Ngayon, the AED independent at saka AED override. So I'll start with AED override. Kunwari ito ay manual defibrillator with cardiac monitor. So marami siyang switch. Meron siyang 9, lalo na pinakabago ngayon, 9 parameters. Ano yung 9 parameters? Machine with 9 parameters. So, alam niyo? 9 yata yan. Yeah. Isang machine na siya, kompleto na siya. Number 1. Yung machine mo, pag i-on mo, pwede siyang cardiac monitor. So meron siyang limb leads or limb leads, kung high-tech ka pa, can perform 12 lead ECG. Dalawa na. Yung limb leads, yung kinakabitan lang natin ng DAX, limb leads po yan. Ang minimeasure niya, lead number 1, Roman numeral 1, Roman numeral 2, Roman numeral 3, ABR, ABL, ABF. Pero ang kanyang default is Roman numeral 2. Pag nag-ACLS kayo, i-describe ko bakit Roman numeral 2. Ngayon, so what? 2 na. Cardiac monitor with limb leads, saka 12 ECG. Ano pa? Systolic, diastolic, cardiac rate, mean arterial pressure. 6 na. Ano pa? Pulse oximetry. Ano pa? Defibrillator. 9, hindi pala 9, 11 yata or 13. Defibrillator. Ano pa? Cardioverter, transcutaneous spacer, capnometer, 11 nga. Capnometer. So, isang machine, ang daming nagagawa. Pag nag-airme, di ba kayo, maganda yun. Tapos 11, yung pang 12 niya, meron siyang AED override. Kung high-tech pa, meron siyang filter. Ano yung filter? Pag pinilter ko siya, habang nagsi-CPR ka, nababasa niya ano yung rhythm ng heart. Kasi pag sinisipr mo, magulo po yun. Ang cardiac monitor, maging magulo. Kasi may electricity ako. Pero maganda yung sa machine na yun. Kaya niyang kunin ano ang intrinsic activity ng heart na yun. Kung BF, naka-BF pa ba siya. So pag pindot mo sa filter, kuhang-kuha yung BF. Hindi niya babasahin yung pag-compress mo. Galing na? Ang merong ganyan so far, nalaman ko ay Zol saka hindi ko alam kung cardiac science meron. There was one time, gumamit akong cardiac science, magaling, maganda rin. Kasi study siya, pwede mong itapon yung defibrillator. Mahilig ako sa study material kasi field kasi ako, hindi ako pwede yung mga gamit niyo sa ospital na masyadong cute. Sa akin, kailangan matibay kasi subject to elements. Na uulanan, pag nag-transport, bagsak, nasa loob ng helicopter, grabe yung floor vibration. So, hindi pwede ako na maganda ang gamit ko na cute. Kailangan ang gamit ko matibay. You know, where I'm coming from, no? Sa ganyang type of work. So, may AED override. Pag AED override, mag-AED siya. Magsasalita siya. AED mode. Out. AED mode. Yan. Check responsiveness. Yung manual mo, naging automated na. So, correct, naka-CPR na ako. Open patient's bare chest. O, ito na open, naka-CPR na ako. Check for pulse. Or call for help. Wala na, tuloy lang. There's no pulse. Start compression. Tit, 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 tit. Sabayan ko na yun. Tit, tit, 2 minutes yun. Tit, 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 tit. Pag after 2 minutes, analyzing, bitaw. Yan, gano'n lang. Meron ding AED na AED lang. Ngayon sa Pilipinas, ay kinakampay natin na magkaroon ng PAD. So nakikita na natin sa airport. Sa airport pa lang. Public access defibrillation. So, kinampay ng Red Cross. Ako po yung ginawa nilang isa sa campaigner. So nag-release sila online. So ako yung campaigner, nagsalita ako the importance of defibrillator. So nag-campaign. So ginawa namin sa national headquarters ng Red Cross sa EDSA. So I'm an advocate of a public access defibrillator. Bakit? Sabihin ko ulit, tataas ng between 70 to 80% ang survival ng tao with a defibrillator. Ladies and gentlemen, one of the greatest inventions of man for humanity. Kasi maraming invention ng tao, not for humanity. Atomic bomb, mga gano'n, kasiraan ng tao ang ginawa niya. GMO, genetically modified. mga pagkain. No? So, may mga tao, na-invento ang tao na hindi para sa tao. Going to Mars. I don't like people going to Mars. Punta ka ng Mars. Ang gawin mo sa Mars? You want to go to Mars? You have not even gone to yourself. Sira pa rin ang pagkatao mo. Punta ka sa Mars. Sisirain mo ulit yung Mars. Kasi hindi mo kilala ang sarili mo. Destroyer yung hand. So, ang style doon, don't go to Mars. Go to yourself. Alamin mo ang sarili mo. Ma-realize mo, magkaroon ka ng intrapersonal intelligence. Then mas maging maayos kang tao. Maayos ka para sa kalikasan. Yun lang. So, independent AED, ito 3 switch. Merong AED na lead unit, okay. Meron naman, pag open, mag-on and off ka, on. Unit, okay. Check responsiveness. Depende from the AED. Unit, okay. Apply, patch. Tapos ito, meron siyang pediatric adult mode. Pag pindot mo, pedia mode. Tapos, kabit yung pads. Siya nang bahala sa voice prompt. Tapos may mga drawing. Tapos, pag sinabi niya, shock advice, stand clear. Pipindutin mo itong pula na may lightning. Lahat ng AED, usually kinukulayan nila itong pula or kinukulayan nila ng may ilaw or may kulay na may lightning. Pag pindot mo ito, gaganon ng tao. Shock given. Check responsiveness or shock given. Continue CPR. Bahala siya. Depende anong machine. Okay. Pointers. Don't commit the mistake I committed. 1. Lagi araw-araw dala kong AED. Iniiwan ko sa sasakyan. Yung sasakyan umiinit. So nasisira siya. Sa sobrang init. Sa halos isang taon. Kung meron siyang display, mawawala yung display. Masisira yung LED. So lesson yan. 200,000 yung AED ko. Nasira lang yung LED. Pinalitan ng zone. Other than masisira ang battery sa init. Ang maganda lang sa akin, nung inom ko siya, meron akong bubuhayin tao. Replace battery. Di pahiyang-pahiya ka ngayon. Manual override ko. Yung AED ko may manual override. Kasi pwede siyang gawing cardiac monitor. Yeah. So, that's the. Sobrang lamig naman, grabe sa opisina ninyo, bantayan ninyo. Kasi iniwan nyo, akala okay ang AED. Ang lamig po, kumakain ng battery. By the time i-on mo yung AED after 6 months, replace battery or wala na. Kasi nobody minds the AED on the wall na sobrang lamig ng aircon, nag-freeze kayo. Ang baterya, kinakain ng lamig. Yan yung tandaan yung error. Third error, hospital. Wala akong hospital, pero may mga doctor, nurses nag-order ng AED. Again, that's wrong. We are not supposed to use this one because this is only for lay people. Tayo ay manual. Okay. Question. Tanong. Is there such a fully automated and semi-automated? Tama kayo. Nung panahon ko, meron tinatawag na semi-automated. On. Ikaw ng AD. Analyze. Ikaw mag-analyze. Yan yung semi-automated. Hindi katulad ditong lahat natin ngayon. Sila na nag-analyze. Tapos fire. Ngayon, on, saka fire. Ang machine na mag-analyze. Ang tawag doon, fully automated, saka semi-automated. Very good question. Any question? Wala? Okay. Let's go into risky breathing. Dahil dito nagkakamali ang nurses and doctor for a number of times. Oh, may inis kayo sa akin, pero ito yung totoo. Nagkakamali kayo dito. So I'll put a dummy. rescue breathing using bag-valve mask. Naki-COVID na tayo ngayon. Okay? Bag-valve mask. Uy, ano to? Bakit mali? So, pinauso siya para pwedeng mabitbit sa araw-araw. So, sa bag ko, meron akong ganito. So, it's a bag-valve mask. Magic. Ang problema lang nito, wala siyang HEPA filter. Lipat ko lang ito isa. Dalawa ang ating camera. Okay, one. Maraming nagbabag-valve mask, ganito ginagawa sa buhay nila. Apex base of the triangle. Ganito lang. Very good. Napaka-very good niya. Ha? Mali yan. Pag nag-bagging kayo, kailangan tight seal. COVID man o hindi, tight seal. So, paano natin ginagawa? Letter C and letter E. Letter C and letter E. C, hawak dito sa mask. And E, hawak sa brim ng mandible, yung bony, huwag sa gitna. Huwag dito sa gitna, matutuak ang pasyente. Dito sa gilid. C. So, ang hawak, ganyan, ganyan. Tapos, E, hyperextend. Pag i-hyperextend mo, the rigid part of your cartilage in your airway will be pushed down at yung anterior portion of your cervical, which is also rigid, plus the cartilage, iipitin ang esophagus. Kaya hindi ka na, wala nang, sarado na sa esophagus. Kung nagbigay mo ng hangin, hindi na magkakaroon ng gastric insufflation. Hindi pupunta ang hangin sa gastric. Tapos hindi siya magbi-bleed ang hangin dito kasi nakasil. So, hyperextend. Okay, and then blow, pump 1,000, 2,000, 3,000, 4,000, 5,000, 6,000, 1,000. Huwag masyadong malaking kamay na boom. Kailangan mga around 600 cc. Tama lang yung tidal volume ng Filipino configuration ng kanyang lungs. So itong wrist ay nandito sa forehead para kalso, para maiangat ko. Yung angat. Oh. So 3E and then C. 1, 1,000, 2,000, 3,000, 4,000, 5,000, 6,000, 2, 1,000, 2,000, 3,000, 4,000, 5,000, 6,000, 3. O nag-CPR. Pag nag-CPR, diyan ka lang. Pwede mong bitawan, pero ito na CPR. By the time na 29, 28, 29, 30, nakaganon na ako, analyzing, gumano si defibrillator, huwag kong itanggal. Dati iba nagtatanggal, huwag kong itanggal. Diyan lang. Non-conductor naman yan. Shock advice, zero po ang oxygen. Kailangan may oxygen line. Ilagyan ko. Oxygen line. Zero ang oxygen. From 15 liters per minute, zero. Tingnan zero, nakikita na. Sigaw siya, walang clear. Clear, clear. Clear. Everybody's clear. Sigaw din ulit ako. Clear. So, shock. Ganoon pa siya. Shock giver. Check responsive. Check for pulse. Ang mag-check ng pulse, ako. On muna ang oxygen, check for pulse. Or pwedeng check for pulse, 1,000, 2,000, 3,000, 4,000, 5,000, 6,000, 7,000, 10,000. Pero ang oxygen, kailangan naka-on. On muna oxygen. Okay, no pulse, continue CPR. CPR, 10, 27, 28, 29, 30, 1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 0, 1, 2, 3, 4, 5, 6, compress. 2, 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 3, 0. Bago pa mag 3, 0, yan. Pag dalawa kami sa airway, isa lang yung nagbabag, pero huwag manggigil na buong bag ibag. Yung isa, ang hawak, nandito, dalawa. Dadalawahin niya ang kamay, dalawang C, dalawang E. Paangat. Isang nasa side, nagbabag. Okay lang yun. Okay. Analyzing. Ito, yung isa, ganun lang, hawak. Hawakan ko, kailangan walang basa. Oxygen. Shock advice. Okay. Sigaw siya yung, ano, one and clear? Zero. Clear, clear? Clear! Everybody's clear? Clear! Shock! Shock given. Check for pulse and responsiveness. 1,000, 2,000. Pag-iwan ng oxygen. 5,000, 6,000, 7,000, 8,000, 9,000, 10,000. Ano, continue CPR pa or advanced mag-ano na, ACLS na tayo, mag-IV na. Pag nag-IV ka na, ACLS na yon. So ready na ako. Kuha na ako ng pag-ACLS. Pwedeng laryngoscope aided intubation or supraglottic intubation. Yan. Okay? Ngayon, kung gusto natin gumamit ng airway adjunct, which is part of the basic program, kasi medyo trauma, or kung gusto mo ng airway, gamitan natin ng pinaka-famous ginagamit natin, oropharyngeal airway, which is Gedel, indifferent sites. I-measure natin from the lobule up to the corner of the mouth. Ito lang. Insert, pataas. Tingnan niya, hindi nakikita kasi puti-puti. O, yan. Lagyan ko ng bar. Ito yung curve shock. Curve shock. Dito ko i-gano'n sa curve shock. Curve. Ang tawag nito air channel. Ang tawag nito bite portion. Ang tawag nitong plate na to is flange. Para hindi masuksok sa... So parang kung ako ang pataas muna, pag nataas 50% twist. So dito, ganun ko lang ha. Para makita niya. By the time nasa 50% na ng curve shock, i-twist mo siya. Yan, ganyan lang. And then, you can back. Kung gusto niyo gamitan ng nasopharyngeal airway, okay din. Pero dalawang measurement. Number 1, ang kanyang external diameter must be kasing laki ng 5th digit niya. Okay. Next, ganun din ang haba. Ito mas mahaba. Diba? Okay? Tapos, ang problema nito, kailangan nyo ng petroleum jelly. So, insert. Pag sa totoong buhay, pag in-insert, ganyan po ha. Pero dahil ito ay dami, ginanon ko lang muna kasi medyo maganit na yung rubber to rubber. Ganyan ang forma niya. Ayan o. So, mas maganda to kasi sa patient na semi-conscious, pwede. Ito, totally unconscious kasi pag semi-conscious ang pasyente nito, iluluwa niya talaga, mag-aaway talaga kayo. But these are two basic adjuncts of different sizes na ginagamit natin. So usually, sa airway kit mo, may BBM ka na, meron ka ng set of Gedel. Pero pag military kit ka, katulad ng mga dinadala ko, meron ako, para masanay ko yung lahat ng bag ko, dito pa lang may 3 bag ako. 1, 2, and 3. Lahat yan may airway. Hindi pwedeng lipat. Kasi may mga kanya-kanyang karga. So, katulad dito, ang first aid kit ko, ayan. First aid kit ko yan. So, lahat ng bag ko may first aid. So, meron siyang airway. Kita mo yung green. Ayan. Ito, chest shield, needle decompression. Malalaman nyo sa ACLS paano ginagamit sa needle decompression. Burn shield, abdominal, pag lumabas yung bituka mo. abdominal gauze, tapos iPad, ang ano sa mata, pag may iPhone. So, ito siya, tapos kailangan naka-airtight. Hindi dahil ayaw ko siyang masira. Kung hindi, kung nasa tubig ako, na bahain kasi alam niyo sa Pilipinas, 86% ng sakuna ay kadahilanan ng bagyo at pagbaha. So pag airtight siya, tapos kailangan ko ng panlutang sa tubig, lulutang kasama kasi airtight siya, may air spaces siya. So yung bag ko mas lulutang. So, may gamit ako. Hindi ako nagdadala ng stethoscope kasi ang stethoscope ay hindi nakakabuhay ng tao. Yan yung mali naming mga doktor eh. Puro tayo stethoscope, doktor. Dating doon, tawanan kita eh. Nagkaroon ng tension pneumothorax. Paano mo sakitin yung tension pneumothorax? Stethoscope meron. Nasa kotse, stethoscope, sinasabit. No? Parang status symbol eh. Ako, no way. Hindi ako nagdala stethoscope. Needle decompression, hemostatic dose. Yung hemostatic dose, pag tinama mo sa... By the way, pag nag-first aid kayo, makikita niyo yung pinakabagong training sa first aid tomorrow. No? May first aid tomorrow after ACLS. Makikita niyo yung new management of first aid. Kasi yung first aid dito sa Pilipinas, I will not say sorry ha, kasi I'm a man of science, like you. Ang ating first aid dito, magalit na kayo sa akin kung kayo instructor ng kung saan. Antiquated na po yan. Antiquated. Okay? So it's fine if you get mad. But your first aid is a British Museum piece. Pangit no? Kasi ang medical science is dynamic science. Kaya kailangan update. So, yun na. Kaya, ang meron ako ito. Hindi ako nagdadala nito. Tapos yung aking nasopharyngeal airway ay sukat ko. Size ko. That's the issue there. Para gamitin yun sa akin. Ang tawag doon IFAC. Individual First Aid Kit. So wherever I go, meron akong IFAC. Okay? Yeah. So again, pagpasok nito, hindi ganyan. Tatama sa 2 minutes, ganyan ang pasok sa totoong buhay. Pero siya, dahil dami, kaya pinasok ko siyang pag ganun. Pero pag nag-live na kayo, ganyan. Ha? Yan. Okay. Question. What else? Naloxone, sorry guys. Ito ang non-rebreather mask. Meron siya mask, two-way valve, nawala na yung valve, tapos reservoir. Tapos ang kailangan, para ma-achieve natin ang 90% oxygenation, kailangan ang iyong oxygen ay merong 15 liters flow rate. Karamihan sa ospital ninyo, 10 liters, hindi po yan. That's a medical oxygen with a humidifier. Ang emergency oxygen ay walang humidifier, meron siyang 15 liters. Pag nag-arrest ang pasyente, ang hangin na dapat bumubuga sa linya mo ay nasa 15 liters per minute. Yan po yung Oxtine style. Ngayon lang kayo nakarinig ng Oxtine style. Magbasa kayo ng EMS book, magbasa kayo ng emergency medicine, 15 liters per minute. I am shocked sa Pilipinas, ang ginagamit pa rin ay 10 liters. Nakakatawa na po tayo at hindi po siya maganda kasi violation po yan sa evidence-based medicine. Pag nakunan tayo ng video or nagkukuha kayo ng video, pinost ninyo, akala nyo heroic kayo. Pinagtatawanan ng Pilipino because we are not really a people of science. We end up like people marites lang. Please, in an emergency, 15 liters per minute. So, naka 15 liters per minute ako. Bago ako mag-compress, ay nakalagay. Para pag nag-compress ako, yung aerosol matatak. Hindi masalilipad. Ano mo lang, dito lang siya. Okay? Eh, meron akong electric fan, tapos meron akong outlet. So, meron akong wind corridor. So, yung mga microparticulates and aerosolized substances, na defeat ko na. Yan ang interim guidelines of 2022. Kaya pag tinanong kayo, ang BLS po namin ay interim guidelines of 2022, tataas ang kilay nila lahat kasi sila hindi nila alam yon. Yan po yung latest ng basic life support guideline. Okay. Now, let's go into addressing basic line. Lagay ko lang dito. Ulo, katawan. No? So, doon ako sa pinaka-list na lugar na walang gaanong gamit. Pero meron gamit pero walang manpower, kulang lahat. So, doon ako para masakot ko lahat. Ayaw ko magturo na purely AHA kasi sa US, Canada, kompletong gamit. So, dito ako sa walang gamit ka. Ano ang style? Okay. So, male ward or oncology. Oncology na lang. Social. Walang oncology sa periphery gamit. Ano na lang, step down care. Regular ward, normal ward. So, pasyente, may mga ano, ito siya, CKD. So, nakitaan siya na mataas ang sodium, ang serum potassium. So, sinihintay yung specialist at saka pag-core para dalhin sa Manila. So, meron ng tutulong kasi mababait ang Pilipino tutulong na hindi pa lang dumating yung pansagitay. So, while in the ward, andun si 14 years old na anak. Yeah. Tapos ikaw, nag-iisang nurse plus isang orderly or nursing aide or midwife. Tapos isang orderly, tatlo kayo. Sa ward na meron kayong 20 pasyente. Yes, mga typical 20. Biglang sumigaw, nurse, nurse, nurse. Si tatay walang malay. Si tatay po, si tatay. Di takbuhan lahat. Tumakbo ka. Ang tumakbo, si nurse. So pagdating ni nurse, kita yung pasyente, naka-high back rest, tinapik. Check for responsiveness. Tingnan nyo ha. Sa patakaran ngayon sa COVID, hindi na po dalawang kamay. Kasi pag dalawang kamay, malapit ang airway ko sa airway. Okay? Atras muna ako, may mali ako. Bago ako nag-responde, naka-N95 ako. N95. Tapos, naka-shield. Kasi yun yung tama eh. Yun yung interim guideline. Although nag-step down na ating alert level. Wala na. Hindi na siya COVID emergency is not there anymore. Pero meron kang minimum. So, naka-N95 pa rin ako at naka-eyewear. So, itong eyewear ko na to, hindi po ito yung degrado. Nasanay na ako nagsusuot nito. It's a trauma. Para kasing everyday sa akin, merong enkwentro na trauma. Pag nagtalsikan ng dugo, hindi matalsikan na ako. Sipin mo, matalsikan ako ng HIV, makakuha ko ng HIV. Sa mata lang. No, matalsikan. Okay. So, high back rest. Isipin nyo, naka-95 na lang ako. Tapik. So, ang tapik, hindi ganito. Nasa right side ako ng pasyente, so right to right. So, mas malayo. Sir, or pangalan niya, Pedro Juan de la Cruz. Mr. de la Cruz, Mr. de la Cruz, Mr. de la Cruz. Mr. de la Cruz, tapos trapezius speech. Non-responsive. Code blue, bed 7. Code blue, bed 7. 4,000, 5,000, 6,000, ibaba, 7,000, 9,000, 10,000. Patient has no pulse. Baba yung bed. Delay number 1. Cardiac board. Insert cardiac board. Delay number 2. Nag-iisa pa lang ako. Wala akong kasama. Nag-iisa pa lang. Saan yun? So, lagay mo na ako dito. Emergency oxygen line. Lagay mo na ako. Tingnan mo yung delay ha. Ay, nako. Yan. Okay. So, delay number 3. And then start compression. Kili-kili yan. Compress mo. Okay, 1. Tuloy-tuloy lang yan. Walang 30s. Tuloy lang. Dumating na yung kasama ko. Okay, dumating na. Okay, sir, stop. Pag stop niya ngayon, palit na bag-valve-mask. Bag-valve-mask na siya. Okay, isipin niyo lang, may naka-bag-valve-mask na. Okay, 30s to 2. Tira. 4, 5, 6, 30. 1 and 2 yung kasama ko. Ito nakakonect sa oxygen at 15 liters per minute. Yung kasama ko, nag-abot lang ng AED kasi yung pasyenteng isa may problem din. Sige, binigay sa akin ang AED. Ako na nagkabit. Okay? Hirap bang nahulog pa yung bag ko. Tuloy-tuloy lang. Inon ko yung AED, naka-on. Tuloy-tuloy lang ako. 30, bag. 1 and 2, tuloy-tuloy lang. Si AED, nagkukuman ka niya, check responsiveness, huwag mong sundin. 1 and 2. Tit, 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 tit. Tapos 31 and 2, biglang analyzing, bitaw lahat. Shock advice, stand clear. Shock advice, stand. Okay guys, 1 and clear, 2 you clear? So siya nakaganyan lang. Clear. Everybody's clear, clear. Pindot, gaganon pa siya. Shock given. Check for pulse. Pwedeng ako, pwedeng yung airway. Checking pulse. Asan na yung cold blue team? Sir, cardiology. Nasa kabilang hospital, papunta na raw. Si anesthesiologist, katatapos na ng operasyon sa itaas, sa OR. Pababa na raw. Naku, wala pa. Tuloy-tuloy ka lang. 30 is to 2, 30 is to 2. Analyzing, gano'n. Yan lang yung BLS. There's nothing you can do. What if the patient is, kunwari, nakamorphine, press case sa ER, kung meron kang atomizer, wala pang ganyan sa Pilipinas. Out. Dinadaan pa rin sa IV. Pag dumaan sa IV, hindi na po siya BLS. ACLS na po siya. Saglit lang, may emergency call. Yes, sir. Oh. Sorry Bulacan State University. Meron natin Okay. So ang BLS is a compression, shock, compression, shock, compression. Now, in the hospital setting, the patient, assuming nabuhay mo, after 2 shock, katulad nangyari sa akin, wala pa akong gamot. Huwag kang huminto doon. The patient must be brought to CCU kasi baka nabuhay siya, pero yung heart niya hindi siya ganun ka-strong. Normal, pero hindi makasipa. So huwag kang maniwala. Baka kailangan pa niya mag-inotropes, mag-chronotropes, or inotropes para mas makapag-pump na oxygen to the brain. Then that's ACLS. Okay? Anything that you will give sa IV ACLS. Lahat tayo dito, basta non-invasive, pag-airway lang ng ganito, BLS. Nagbigay sa ilong, BLS. Pag nag-IV ka na, pumasok ka na sa mundo ng ACLS. Yan ang tinatawag natin, BLS as a bridge to ACLS. Okay, pero kakaiba ngayon. By the time nagdatingan si Cold Blue, ang ini-emphasize ngayon sa ACLS, continuous CPR is IV sabay na sa airway. First pass mechanics. Kailangan naka-airway ka agad. Yan na si ACLS. Hindi katulad dati, IV. After 1 or 2 runs again, saka mag-airway. Ngayon hindi. IV ka, airway ka agad. Ang point doon is close circuit mo para hindi na kumalat si COVID. Yan ang interim guidelines of 2022 for ACLS na. Yan. So, mayan ang matutunan natin mamaya. So, the patient is okay. So, 2 things. In the hospital, ganito pa rin posisyon, hindi natin siya nilalateral kasi kailangan meron tayong airway support. Sa field, nire-recovery position namin. Yan, ganyan, tapos, yan sa field yun. Sa hospital, hindi. Unless, wala kang ICU or CCU or medyo advanced life support, mga critical care sa hospital, magsaside ka para i-ambulance mo, ready for ambulance, transfer to kunwari, birthing clinic ka lang, or barangay health outpost ka. Yes. Lateral recumbent. And then, bring to the hospital. On a lateral recumbent position. Ngayon, BLS for drowning. Pag BLS for drowning, ang recovery position mabilis. Di ba? Drowning. So there will be 6 questions in drowning. Number 1, what kind of water siya nag-submerge? So dalawang klaseng drowning. Drowning by submersion and drowning by immersion. Ang drowning by submersion ay nalunod siya sa ilalim ng tubig. Ang immersion is wala siya sa ilalim ng tubig pero binuhusan ng tubig ang mukha niya, nakahiga siya, kunwari yung torture yun, drowning by immersion. So, question number 1 is, anong tubig siya? So, there are 6 types of water. Number 1 and 2, fresh water, salt water. 3 and 4, warm water, cold water. When is the cool water? When do you say it's cool water? When it is 20 degrees centigrade to 10 degrees centigrade. From 10 degrees centigrade to 1 degree centigrade is cold water. Where do you call it's warm water? When it is 22 to 39 degrees centigrade. So, ganun, evidence-based medicine, according to Utstein style. Magulat kayo, saan galing ang Utstein style? You search it there. Nakakawa, ang Pilipinas, hindi pa nag-Utstein style. Karamihan countries nag-Utstein style na. Pilipinas, wala. No? Grabe. Pero kung paastahin mo sa mga Pilipino, siga-siga, pero walang standard. No? Kaya nakakatuwa minsan. Maraming nagtuturo na sabi na, we are the standard. Pag tinanong ko, Utstein style ba yan? Hindi. Ang standard po ngayon ay Utstein style. Pag hindi ka nagturo ng Utstein style, sarap ng buong mundo, out ka. Okay? Yan. No? Utstein. Yan na yung language ngayon. Malalaman yan bukas sa first aid. Utstein yung ituturo. So, itong drowning Utstein. So, apat na, no? Fresh water, salt water, warm water, cold water. Next is clear water and dirty water. So, yun po yung unang katanungan. Pangalawang katanungan, gaano katagal ang pasyente na submerged sa ilalim ng tubig? Ano ibig sabihin? Halimbawa, 5 minutes siya nasa ilalim ng tubig. So, question number 2. Number 3, gaano katagal siya na-respond niya? Assuming 5 minutes din bago siya naabutan. So, ilang minuto na walang hangin ang brain? 10 minutes na. Number 4, ano yung skills na tumakbo doon, nag-responde? Kailangan tanungin, alamin mo. Number 5, very critical. Naka-aspirate ba siya? Nakalanghap ba siya ng gumitos? Yan po, pag pumunta sa korte yan, talo ka dyan. Kailangan ng pasyente hindi maka-aspirate ng gumitos. Kasi ang pasyente, habang sinisipian mo, pag sumuka yan, pag malakas yan, gising na yan. Tatagilid talaga. Tatagilid siya. What if the patient is so weak? Pag suka niya, ganun lang. Ganyan lang siya, hindi makatagilid. Hindi mo siya tinagilid. Patay. May higop niya. So ganito po pag CPR. Tingin sa akin. Tingin. Pag CPR. Para ma-defeat natin ang suka. Okay? Pag suka, tagilid ka agad, sabay tapik. Pwede mong gamitin ang damit or yung balikat. Yan. Ganyan, kabilis. Hindi na maghintay na. Ganun sa 1 and 2 and 3 and 4. Wala na. Nalanghap na niya ang suka. Okay? So doon, mabilisan. Pag suka, bilis. Tapik sa likod. Sige. Tapos ito, tandaan nyo. Number 5, saang ospital dinala? Kailangan ang pasyente, pag na-drown at nabuhay mo, kahit pa sabihin niya, ay okay na po ako sir, anghel po kita, nabuhay po ako dahil sa uwi na po ako, huwag niyo pong pauwiin. Kailangan obligado idaan sa ospital para maobserbahan of minimum of 3 days. Kasi pwede siyang magkaroon ng secondary drowning sa lumang tugtugin. Ang Utstein hindi gumagamit ng secondary drowning. Ang secondary drowning po, kunwari ang tubig na kanyang nalunod, kung saan siya nalunod ay maalat and or marumi. Merong mga sediments. Magaspang yan. May mga taong very sensitive. So, umuwi sa bahay o nasa ambulansya, nabuhay mo na, biglang sa pagdating sa ambulansya, kumano, no? Naglaringgos pasa dahil merong trigger. Yung mga dumi na naiwan doon. Ang tawag niyan sa lumang pre-hospital book is secondary drowning. Tinanggal na po yan ngayon. Tinanggal yung dry drowning, wet drowning, secondary drowning, tinanggal na yan. Ngayon, drowning lang. Tapos pag nag-arrest siya, sabihin lang na ARDS, Adult Respiratory Distress Syndrome, due to primary cause which is drowning 2 hours ago. Kunwari, 2 hours ago or 30 minutes ago. Ginagawa ng storyline. Hindi na tayo gumagamit ng secondary drowning. Pero, kung gusto mong gamitin ng secondary drowning, kasi may element of drowning kanina, nabuhay mo siya, secondary drowning, i-close parenthesis mo, non-Utstein style assessment. Non-Utstein style. Pag ako binasa ko, itong taong nagsulat na to, the best to. Another thing, I want you to research Orlowski score. Orlowski. Iiwan ko na yun sa inyo, hindi part ng BLS. Pero baka balang araw, pag nag-emphasize sa drowning, isasama na sa BLS ang Orlowski score. Kaya siguro hindi sinasama sa BLS kasi dinedetect niya, kailangan ma-detect ano ang pH pag kinuha mo siya. So ang Orlowski, ginagamit natin siya sa pediatric drowning. Okay? Pero basahin niyo ng Orlowski scoring. Okay? Para naman high-tech tayo. Pag ang mga Pilipino, nasa larangan ng international standards. Para hindi tayo maliit-maliitin. Tandaan niyo. Okay, so ganun lang po ang basic life support. Ngayon, tatlo kami. Isang nagko-compress, isang nag-airway, at isa sa kabila, ang nag-electrical therapy or nag-defibrillator. Ang maximum sa BLS is 3. Under interim guidelines of 2022, minimum personnel requirement. Sino ang team leader? The one who fires. Ako nag-compress. Analyzing. Pag analyzing, takbo na kaagad ako sa kabila, siya takbo dito. Balik na. So ready na ako mag-compress. Shock given. Shock advice, conflict. Siya na mag-command. Sana kayo ng team leader. Okay, team leader noon. 1 and clear, 2 year clear, sabi ni Erwin. 0 clear. 3 awareness clear, clear. Pinindot niya, defibrillator, nas wala. Shock given. Continue CPR. Ako na magsi-CPR. Siya ang team leader. Pam, 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 pam. 30! After 2 minutes, 30. After 2 minutes, analyzing. Pag analyzing, takbo ulit. Ang takbo, hindi pwede sabay. Isa lang. Ang unang aalis ay ang defibrillator side. Kasi ang huwag mong iwanan, ang compression. So tatakbo siya dito. Pag nasa likod na, takbo na ako doon kasi ako yung magpapaya. Shock. Advice. Time clear. Okay. Arm na clear. 2 year clear. Sigaw siya 3 and clear. Clear. Pindutin. Shock given. Continue CPR. Ako na naman mag-CPR. Bam, 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 bam. Until the patient goes back to spontaneous, there's a spontaneous return of circulation or the patient di na mabuhay. You have to remember, people, that there is a heart which is too young to die. Yan yung objective natin, mabuhay natin. But you also have to remember, colleagues, that there is a heart which is too old to live. Let's give it a decent death. Tanggapin natin yan. Sana matanda na, kasi CKD or terminal cancer, it's part of life cycle. Ang tao takot na matay. Bakit? Alam ko karamihan sa inyo. Because you have not lived. Person who has not lived is afraid to die. But you have to remember, kahit sino ka din ngayon, nakatayo ka, kahit pinakamagaling kang doktor, death will find us all. Even if we live in towers, built strong and high. So ready ka rin. Okay? But with this program, basic life support program, this is there sa 99% of those, the survivable heart, the heart which is too young to die. BLS program is good. It's not rocket science. It is only by muscle repetitive na pag nag-compress ka, sakto, yung inyong siko ay hindi nakabend. Ganun siya. Ganun, no? Straight, hindi bend. Tapos, hindi jerking, kung hindi, ang katawan ang sumasayaw. Katawan ang sumasayaw, yan. Tapos, Hindi siya yung rocking. Kailangan alalay lang. Pinagilid ko lang na para makita. So, yan lang. Ang katawan ng, it's like a dance. Ang bilis, ganyan. Ito, sa bilis na to, 120 to. Tapos yung recoil, adequate ang taas, ha? Hindi yung gigigil kang gano'n. Yan ang laro. Yan ang laro. Okay? A good basic life support program is a life skill na kailangan matutunan ng new normal Pilipinos para maka-establish tayo ng resilient culture. So with that, na-tackle natin yung chain of survival for in-hospital. Ano yan? Firstly, kasi mag-exam tayo ngayon, may exam tayo ngayon. Yan. Una, ina-ID natin, pinoprofile. Pangalawa, if there is, call emergency services. Pangatlo, okay, good compression, quality CPR. 5, 4, one of the greatest inventions of man, defibrillation. 5, post-ACLS, or post-cardiac arrest care. And 6, recovery, which is the primary support group, community and family. And balik ulit kung babalik ko sa ospital. Yan. Yan lang, tandaan niyo. And then, compression mechanics, 100 to 120 per minute. Badger counting, straight 200. So, it's just fine. Pag AED can run is 200. Sa ideal battery of time, sa time frame niya, makakaubos ka ng 5 cycles. Okay, so 100 to 120. So, compression mechanics. Tapos yung rescue breathing, the using of bag-valve mask na letter C, letter E, very tight. So, bigay ka ng 1 blow per 5 seconds to 10 seconds. Blow, tapos sakto lang na 600 cc. And then, naloxone, by theory, spray lang. Tapos, kung hindi pa nag-reverse, tawag ka sa doktor, sir, can I do, kunwari, 4 milligrams naloxone, then you can jack up to another 4. Or kung Cloxado, which is 8 milligrams, ask medical control. AED operation, it's not rocket science. You should know your machine. It's the man, the machine, and the mission. Let 3M. The man, the machine, and the mission. Okay, and then the format of the personal response, the ideal is minimum 3. The airway, the compression, and the electrical therapies. Aabot tayo ng 4 pag ACLS. Kasi sa interim guidelines of 2022, limit the personnel at kailangan naka-level 3, level 4 kailangan. Although bumaba na ang ating alert level, pero kung susundin lang natin yung interim guidelines, don't PPE at level 4, level 3 to level 4. Naka-level 4 si airway. Ideally, level 4 lang. Pero ito si airway. Ang level 4. Kasi siya yung sasalo para niyan. Ang interim guidelines, kailangan merong HEPA filter, ang mga gamit, lalo ng bag-valve mask, at maganda kung may air corridor. Pag sinabing air corridor, kahit naka-aircon yan, malamig pa rin. Yung may inlet ka lang, napapasok yung hangin, at may outlet ka, na kung saan napipilter. Hindi mo pinasa yung hangin doon sa, nasa ICU ako, pinasa ko sa ward, ang ward nagkaroon na. So, pinipilter ko yan. Kung saan lalabas ang hangin, may filter yan. Para natatrap at namamatay yung bacteria, nasa subject sa ultraviolet, whatever. Okay? So that's the overall program of your basic life support. Right now, we will have, may exam ba? Tanongin natin si Ma'am Joy. Tapos pag wala, manood lang tayo ng BLS video while taking your exam. So that ends our demonstration for basic life support. And this is Surgeon Frankenstein. Nilagyan na para hindi mahiwalay yung ulo. Nahiwalay na yung ulo. Si Surgeon Frankie. He's my dummy. Okay. And if you have any question, I'll just be around to entertain you. Tanong? Ito na wala. So if there's no question, I'll endorse you back to Ma'am Joy for your exam and your BLS lab, BLS video. Okay. Yung BLS video, hindi pa siya updated. Pero andun na yung storyline. But it's not yet the 2022. Baka, ano, ginamit namin pre-COVID pa yung ASHI na yan. Kasi hindi pa nakapa-update yung video. But as soon as we will have the right video. Okay? So don't be confused. The video is just tell you the dynamics of movement and how it's being rolled down how to respond. Pero yung mga interim guidelines of 2022, hindi pa nakapractice kasi pre-COVID pa ginawa. Okay? Ma'am Joy, endorse ko sa iyo. So wala na silang tanong. Hello, Ma'am Joy. Or anyone from WIPAM.
Hello po, Doc.
Okay, so mag-exam sila?
Yes po, Doc.
Sige. So, endorsing to you, but I'll just be listening in case if there are questions that will pop out. Okay? So, good luck. No, not luck. I don't believe in luck. Do well in your exam.
Thank you po.
Hello po. I will be playing videos po, and while playing the videos po, you can take your exam na po. Isasend ko po yung link ng exam ng BLS po sa meeting group chat. Yan po. Nasa meeting group chat na po yung exam. You can take your exam na po.
Basic life support, or BLS, is emergency medical care provided by first responders, healthcare providers, and public safety professionals to persons experiencing respiratory or cardiac arrest or an obstructed airway. It requires knowledge and proficiency in cardiopulmonary resuscitation, or CPR, use of automated external defibrillators, or AEDs, and techniques to relieve airway obstruction in patients of every age. This BLS training program is intended for healthcare providers and other public safety professionals working in a wide variety of occupational settings, in and out of hospital, and individuals enrolled in healthcare and public safety career courses. The purpose of this BLS training program is for participants to gain or improve knowledge and skill proficiency in high-quality CPR skills for the adult, child, and infant. This training program will allow you, the BLS provider, to learn and practice skills according to your experience and in the context of your setting, utilizing different practice methods such as video-guided and scenario practices. Cardiac arrest is the loss of the heart's ability to pump blood through the body due to inadequate or absent cardiac function. The most dramatic occurrence, sudden cardiac arrest, or SCA, can happen anywhere with little or no warning.
It was a beautiful, sunny, warm July 31st, and Lynn, my wife, and I had gone grocery shopping.
It was otherwise kind of a typical summer day.
We were unloading the groceries. Lynn and I schlepped some in, and then I went out to get the rest.
We can tell by retracing my steps that I had put some things in the pantry and was headed back out to the car, but I never made it because I went down.
Was only gone about 60 seconds. In that small amount of time, my world changed. Turned her over on her back, and her face was turning blue, and I heard these sounds like she was trying to breathe, sound like she was gasping for air. And it's a sound you just don't want to hear your wife have. You just don't want to hear that sound.
Hello? Hi, I need an ambulance right away.
At what address?
I dialed 911 right away, and I put the phone down next to her and proceeded with the chest compressions and the breaths.
It's my wife. She's turning blue. She's turning blue. I gotta give her CPR.
Is she breathing?
No.
Okay, lay her flat on the ground with nothing under her head. Do you know how to do CPR?
Yes, a little bit. Okay, I'm pushing.
When the call came in and we heard the information, it was a cardiac arrest. If I knew that the crew was not here, they were out training at another station. Knowing it was a cardiac arrest and the importance of getting there quickly and starting care, myself and the battalion chief made the decision to respond to that.
Is your door unlocked?
Yes, I'm right in the
Many
middle of
minutes went by while I was administering CPR before I heard sirens outside.
I entered through the front door and I was able to see CPR being performed in the living room.
I found her laying on the floor.
Quickly encouraged the husband to continue doing CPR and push hard and push fast on the chest.
No, I found her. She was loading groceries from the car into the house. She was helping load them, and then I found her just like this. Please check the pulse. Keep going, push hard.
These last moments of my opportunity to give CPR, and that's how I regarded it, was a great opportunity to actually participate in the rescue. My neighbor, who's a physician's assistant, heard the sirens and she came over to see what was going on.
As I was putting the AED on, the patches, the neighbor identified herself as medically trained.
Yeah, you know CPR? No, I'm a PA. Hey, go.
I asked her to go ahead and to relieve the husband from doing chest compressions at that point and had her start performing CPR.
So she hopped in there to take over because I was kind of freaking out. I mean, right now, even thinking about it is really bringing back the memories. It was terrifying. I felt helpless. I mean, it was now all in their hands. I had done all I could do.
Analyzing heart rhythm.
After analyzing the rhythm of the patient, the AED identified that it was a shockable rhythm, and we delivered a one shock. At that point, I went ahead and took over CPR compressions, and Annie started giving airway assist. And after giving CPR for about a minute, I noticed Lynn starting to make noises with my chest compressions.
I asked him, "Do you have a pulse?" And he said, "Yes, we have a pulse." And I tell you, that was a beautiful sound to hear that.
So we stopped doing chest compressions and we continued breathing for her. That's when the crew, the paramedics and the firefighters were coming through the front door, and I was able to then step back and give a report to the lead medic that was coming in and that was gonna do the transport.
And they got my heart started again, loaded me onto the gurney and rushed me to Corvallis Samaritan Regional Medical Center, where they continued to save my life. When I woke up, they had put posters on the wall in front of me. And it was very orienting. It said, Kent called 911, did CPR. He saved your life. You're at Corvallis Good Samaritan Regional Medical Center.
The CPR being performed by the husband was huge. I'm sure it was probably 2 to 3 minutes. And during that time, if CPR wasn't being performed, that's 2 or 3 minutes that she's not receiving blood. A lot of things went right for this call and for Lynn, the chain of survival.
So it was a team effort, a chain, and that includes our dear neighbor, Annie.
Learning CPR, knowing how to do it, and then actually doing it are really important because you can literally save somebody's life.
BLS providers play a key role in the resuscitation effort following cardiac arrest, both out of hospital and in hospital or clinic settings. By training and practicing, BLS providers can help ensure the links in the chain of survival are strong in any setting for every patient. In order to clearly demonstrate high-quality skills, BLS providers in this training program may not always be shown wearing appropriate personal protective equipment. Local medical protocols are emergency medical service treatment guidelines approved by the local EMS medical director. Local protocols outline the permissible medical treatments that may be given by EMS providers outside the hospital to patients experiencing a medical emergency. EMS providers should always follow their local physician-directed medical protocols.
Marcus, you need to come here, move to Eugene, move to University.
Think about dropping out.
Sudden cardiac arrest occurs when the normal electrical impulses in the heart cause it to beat too quickly, inefficiently, or in an unsynchronized manner. When the lower chambers of the heart beat too quickly or quiver, the heart cannot pump blood. These abnormal heart rhythms, or dysrhythmias, are known as pulseless ventricular tachycardia and ventricular fibrillation. Blood flow to the body, along with the oxygen it carries, abruptly stops. Within minutes, brain cell death starts to occur from the lack of oxygen. A victim of SCA may suddenly collapse.
Grandpa, hey, stay with me. Hey, I need some help. Grandpa, stay with me. Grandpa, don't.
What's going on? Is he okay?
I don't know, he just fell out. I need you to call
Occasionally,
911, please.
SCA victims will experience 10 to 20 seconds of seizure activity when the brain
Hey, I need
stops
some help.
receiving oxygen.
Hey, I need some help.
Normal breathing stops. Abnormal gasping may last for several
I have no
minutes.
clue what happened till he just fell down.
Okay. Let's get his back. Can you hear me? Sir, can you hear me? I have one person down in the main lobby. He's unresponsive. Start me 911 and get an AED. Let's start CPR. He's not breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
CPR is the immediate treatment for suspected SCA. CPR can restore limited oxygen to the brain and other vital organs through a combination of chest compressions, an open airway, and rescue breaths. However, CPR alone is not enough. The most effective way to end pulseless ventricular tachycardia and ventricular fibrillation is defibrillation.
Remove clothes from patient's chest.
Using a defibrillator and electropads adhered to the chest. An electrical shock passed through the chest can restore the heart's normal contractions.
Analyzing heart rhythm. Stay clear of patient.
Immediate, high-quality CPR and early defibrillation with an AED can more than double the likelihood for survival. These two elements are parts of the adult chain of survival, a series of 6 interdependent links that describe the best approach to cardiac arrest care. Each link in the chain is essential for the most positive outcome. If a single link is missing, the chances for survival are greatly reduced. There are 2 adult chains of survival. The links in the chain differ slightly depending on the cardiac arrest setting. The chain of survival for pre-hospital or out-of-hospital cardiac arrest consists of early recognition of cardiac arrest and prompt activation of EMS, immediate high-quality CPR beginning with chest compressions, early defibrillation with an AED when indicated, effective advanced life support treatment, effective post-cardiac arrest care at a hospital, and recovery. The adult out-of-hospital chain of survival includes continued resuscitation by EMS and transportation to the hospital for all patients with a chance of survival. Cardiac arrest inside a hospital or facility usually occurs when a known medical condition worsens, so the in-hospital chain of survival focuses on how resuscitation fits into ongoing medical care. The chain of survival for in-facility cardiac arrest includes monitoring, prevention, and treatment of pre-arrest conditions, and early recognition of cardiac arrest, prompt activation of the emergency action plan and response by teams of medical professionals, immediate high-quality CPR beginning with chest compressions, prompt defibrillation when indicated, effective post-cardiac arrest care, and recovery. The greatest chance of survival exists when all the links of the chain of survival are strong. The majority of cardiac arrests happen at home or in the workplace. Early recognition of SCA and activation of EMS or an emergency action plan gets help coming right away. Immediate high-quality CPR improves the victim's chance of survival by providing oxygen to the heart and brain. After activating EMS, an untrained layperson should provide chest compression-only CPR, ideally with their phone on speaker mode and with the assistance of an EMS dispatcher. Attaching an AED as soon as it becomes available speeds up the time to defibrillation if indicated. Effective advanced life support treatment with a focus on return of spontaneous circulation, or ROSC, and transport to a hospital for all patients with a chance of survival supports the most favorable outcome. Effective post-cardiac care, including monitoring and the use of medication, helps prevent the return of cardiac arrest and improves the likelihood of long-term survival. Recovery supports the patient's physical and emotional needs that are ongoing after hospital discharge.